Blood cleanup service. What to do when dealing with blood. Whether it's your own personal blood or that of a coworker, you need to know what you should do when you find yourself in a situation with a blood biohazard. There are a few things to keep in mind when you are dealing with blood, and they include the types of blood that you are dealing with, the best way to dispose of it, and what to do when there is a blood biohazard on the job. What makes blood hazardous? Whether you are a patient, healthcare provider, or an employee, the risks of bloodborne pathogens are real. Bloodborne diseases can result in infection, respiratory distress syndrome, and death. For this reason, it is important to understand the hazards and how to avoid them. Here are some tips to help you keep bloodborne diseases out of your workplace. The first rule of thumb is to avoid using needles. The most common bloodborne pathogens include HIV and hepatitis B. For this reason, healthcare staff should collect blood in leak-proof containers. These containers must be tagged with the FDA's required label. The Occupational Safety and Health Administration, OSHA, developed the Bloodborne Pathogens Standard in 1991. This standard protects approximately 5.6 million healthcare workers from exposure to bloodborne pathogens. It requires annual training and the development of a written exposure control plan. The plan outlines protective measures for employees to avoid exposure, as well as the records that should be kept. What do you do when there is a blood biohazard? Whether it's a blood spill or a small leak in a toilet bowl, there are steps you should take to make sure you're getting rid of the material safely. If you don't, you could end up with a contaminated area and a liability problem. This is why it's so important to follow a proper blood cleanup procedure. Blood can carry a wide variety of infectious diseases, including hepatitis B, HIV, and hepatitis C. If you are not sure if your blood is biohazardous, you should consult with a professional. To clean up a blood spill, you will need to use a disinfectant. You will also need to use personal protective equipment. This includes disposable gloves, a face mask, and a shield. You can also purchase a basic cleaning kit. The first step in cleaning up a blood spill is to place the spill in a biohazard bag. You should also dispose of any personal protective equipment in a biohazard bag as well. You can also contact your local health department for information on how to properly dispose of the material. What service do you call for blood cleanup? Whether you're cleaning up blood from a hospital, an accident, or a suicide, it's important to follow a set of guidelines to ensure you're safe. The proper use of personal protective equipment, PPE, disinfectant, and containment can go a long way towards preventing infections and disease outbreaks. Blood cleanup is a complex task. It requires professional expertise, safety precautions, and specialized cleaning materials. The best way to ensure you're able to handle the job properly is to hire a blood cleanup service. Blood is a biohazard, meaning it can pose serious health risks. In fact, the blood in your body contains a variety of pathogens, including HIV, hepatitis C, and Clostridium difficile. These pathogens can be transmitted through blood, bodily fluids, and cuts and bites. Blood cleanup is also an excellent way to prevent the spread of AIDS and liver failure. By hiring a professional service, you'll be able to block off the area where blood was spilled, remove any stains, and disinfect the area to prevent future outbreaks. What are the most dangerous bloodborne pathogens? Occupational exposure to bloodborne pathogens is a serious concern for healthcare workers. Bloodborne pathogens are infectious microorganisms that can cause diseases in humans. There are several types of bloodborne pathogens, including hepatitis B and C, HIV, and syphilis. Infections caused by bloodborne pathogens are often chronic and life-threatening. Some of these diseases include viral hemorrhagic fevers, which can lead to bleeding and other complications. Bloodborne pathogens can be transmitted through a variety of methods, including human bites and needle stick injuries. There are several ways to prevent exposure to bloodborne pathogens, including proper personal protective equipment. Some examples include latex gloves, face shields, and eye protection. Some bloodborne pathogens are transmitted by contact with feces, saliva, or urine. Aside from contact with blood, healthcare workers may also come into contact with bodily fluids through needle stick injuries or percutaneous injuries. One of the most serious risks of workplace exposure to bloodborne pathogens is hepatitis viruses. These viruses are most often transmitted through blood-to-blood contact.